think about the last 5 years and working with our customers and working with the folks in the market on this journey from virtual care to digital transformation, it's been more of a roller coaster than anything that's like a straight and narrow journey as it might be. It's been interesting because we've watched organizations think about the transformation occurring in real time and having to react and respond to that everywhere along the way. When I think about organizations that we started working with, right on the onset of COVID, they were making this decision to move many of their brick and mortar operations into a virtual setting just to stay afloat. But what's happened in the last 5 years is as the pandemic passed, organizations needed to rationalize whether it was their spend or their strategy to be able to articulate more clearly what they were actually going to do inside of the space. And from my perspective, that's really catapulted organizations to move from, well, what is virtual care if not just a tablet or an iPad or a phone in the place of where otherwise would have been a face-to-face interaction, to really now thinking about breaking down care delivery pathways and rebuilding them into something that's new and digitally transformed. So I've been able to come alongside organizations in the last 5 years and help them articulate what's the real problem that you're trying to solve. And if we get really intimate about the problem that we're trying to solve, what we usually learn is that a tablet in the place of what would have been a face-to-face interaction isn't the solution. But the answer is, how do you think about the entire digital ecosystem? How do you rebuild a care pathway that actually makes far more sense to be able to solve the problem that the hospital system is actually facing?